Hello and welcome to the Auditing Antics podcast. So today I'm excited to have another guest. We have Yoelvis here from Coding for Health. He is the founder and the main creator of this educational platform that is for those within the Hispanic community. So him and I have met recently within the past month or so and have been talking quite a bit about the challenges that can be in place for those that have the primary language of Spanish and what that can be like trying to go through training, work in the industry, things like that. So welcome. We're happy to have you here today.
Thank you, Stephanie. Thanks for having me. It's a pleasure to me to be here. Thank you so much. I appreciate that.
Yes, definitely. Now, before we jump into some of our questions today, can you give a little overview about your organization, Coding for Health, and what it is that you do to help people in the Hispanic community?
Yeah, sure. Coding for Health was found in 2023 with a mission to help those Hispanic people, Hispanic community who lives here in the U.S. Sometimes when we come from different countries, in my particular case, for example, I study medicine in Cuba, and we when we come here, the process of revalidation on our degree is complicated, is complex, and it wasn't my experience, and also in a couple of friends that I have that was struggling trying to get into the field, into the medical field, and I found this profession, medical coding.
Hmm.
For example, in Cuba, we don't know anything about coding, medical coding. The health system is different,
Hmm.
and I say, okay, how can I study medical coding? And when I go YouTube, all the internet, all the information that I found was in Spanish. It's not our primary language. And then, okay, my English at that time wasn't no good, was like the basic.
Hmm.
And I started studying, and I found that there are a lot of people who even don't know about the field, don't know about the profession. And when I become a CPC coder, then a CRC coder, I still find that a lot of people, I'm trying to get into the medical field, but they don't want to become a doctor because it's staying too long. It stay 5, 7 years, a nurse, for example, and they are looking to work from home.
Hmm.
And I say, okay, I think I can provide education for our Hispanic community in our first language, in Spanish, so they can study a new profession in our language and they can learn in our language. It's going to be more easy to understand the guidelines, the coding process, and everything. And I found Coding for Health, and we are helping those Hispanic community to get into the field through medical coding education, preparing mainly for the CPC certification, which I think is the best point to start in this field.
Yeah, that's great. And one thing that I know that I've experienced when I've met people over the years in a similar situation as you, where you've got medical training from another country.
Mhm.
And I've heard that time and again that it's difficult to come here. It's not like it just transfers over. So
Mhm.
you have to make that career decision to either essentially start over or, bring what you can and dedicate that time or find another route. And I actually met a woman years ago when I was a dental assistant in the beginning of my career journey. I worked with a great woman. Her name's Lucy, and she's from Poland. And it was the same thing. She wasn't sure where to start, so she got into the dental industry, just trying to still stay within that healthcare path in some way. So that's great. Now, I've noticed for myself, I will get asked from time to time, do I personally know of any Spanish, education out there? And until I met you, there was not one particular company I could point to and say, hey, this is a resource. It's really great. It's in depth. They're going to cover everything for you, things like that. Have you noticed that there's a lot of people that have tried other methods before finding your organization?
Yeah, of course. Yeah. Uh, Most of them are going to universities
Okay.
or going to online program who teaching Spanish, but it used to be like university involving in student loans, something like that. Yeah, we're talking about a lot of money if,
Hmm.
to study medical coding. And you and I know that to start medical coding, we need to invest, of course, in our education, but maybe it's not too much, like 10 grand or 15 grand. I think it's not necessary for medical coding, especially when we go to APC, for example. We see the course, we see all that we need to start in the right certification, because I think the most important thing is to start with the right certification. Because
Hmm.
when we go out and post on LinkedIn and we start looking for a job, the employers want that certification from APC or AHIMA
Yes.
mainly.
Yeah.
So I see a lot of students who start preparing medical coding with a diploma or
Hmm.
another certificate, and they are investing all those time and money, and finally they cannot get a job
Hmm.
because the employer are looking for the APC or AHIMA certification. And I say, okay, I think everybody who want to start medical coding, who English is no their primary language, should be starting with the CPC certification, for example, and that's what we're doing, teaching
Yeah.
for the right certification, the employers what the certification the employer wants.
Yes, yeah. And that's a great point because even for myself, my beginning in this industry was going to a local tech college in my area,
Mhm,
and they offered coding classes, but I didn't get really any realistic advice about what it was going to be like in the industry once I wanted to start. And actually, they didn't help you pursue your certification. You had to
mhm,
go and do that yourself later. And on top of it, I didn't know the proper way to research. So I paid for it and went through the program, but then found out that it wasn't really anything that could transfer to another college or things like that.
mhm.
So I actually decided later in life to go back for a second time to a community college for similar courses, but more specific to, these certifications. So
Yeah,
that's great that you have that outlet there. Now, one of the things that I don't know if everybody realizes this because I personally didn't experience this myself until a project that I worked in the Washington, D.C. area. For you you're in Miami, is that correct?
yeah.
Okay. So in these different, locations, geographic locations, there's also times where we largely have different communities that are sticking to their primary language. So when I went into these practices in Washington, D.C., it was a project where I was going in with my client and I was educating typically the physicians and practitioners in the groups. But one thing I started to really notice when I was in these different communities is that, for example, in a Hispanic clinic, there wasn't even anything written in English on the walls.
Yeah.
The staff primarily are speaking Spanish, all of that. I had the same thing too, walking into another practice where everything is Chinese. Nothing in English. The staff barely speak English. So, I do see that there's a large need as well within the US for people who can do these types of services, even if they're able to, bridge the Spanish to the English from there. But really helping these particular practices as well that still have a need. And if we look at the US in general with people like myself, I only speak English. If you were to come to me in Spanish, I would have no idea how to even respond to you. So, there really is a big need, but I don't think everyone realizes what that can look like in different communities and different places.
Yeah, yeah, I think so. I'm agree, um, because the health system here is in English, is how it should be, but in United States we have I think thousand and thousands of people who come from other countries
Hmm.
like Cuba, Colombia, Venezuela, Mexico, a lot of country. We have a lot of culture here in the United States,
Hmm.
and I think provide education in our primary language at the beginning. I think is going to help a lot of people who are struggling with the language to start something new, like medical coding, for example, or
Hmm.
understand the medical coding field, who is a little bit is complex, honestly.
Yeah.
Is
Oh,
how
yeah,
it is.
definitely. Yes. I spent time in a meeting yesterday with an ophthalmology physician, and I think we kind of had his head spinning by the end because he's just like, wow, why did we have to have a meeting with 9 people to figure out what's going on with the practice and how to bill something? So, yes, it is very, very complex. Now, do you find that students that go through Coding for Health have specific challenges once they finish the program and are looking to enter, the career into the industry, whether they're looking for a specific career or just getting their foot in the door somewhere? I would think that there's advantages after going through the program, maybe, filling in blanks of things they really didn't connect before. But what does that experience tend to look like for your students when they complete the program?
Yeah, when they complete the program, I think the most challenging is getting the first job because, like I say, like English is not our primary language. They understand, they approve, they pass the CPC exam, but they still are struggling to communicate their value to an employee.
Mhm.
And I don't know if you noticed, but in the field of medical coding, like everybody want experience, two,
Mhm.
3 years of experience. When they are looking for a new coder, they want experience. And I always say to my student, okay, in my point, what the employers are telling us is, all right, we don't have the time or maybe the money to train you or to pay for or wait until you get trained. For example, if you can in that interview, like say or let them know all your value on all the
Mhm.
things that you know that you can provide value to that company, how you can help them. If you can do that, even if they are looking for 5 years experience and you have zero, if you can demonstrate that, you can get hired. That's
Mhm.
what I always say to my student. But I think the most challenging part is get that first job. What do you think about this topic? Uh,
Yeah.
the employer looking for experience every time, and I understand why.
Yeah. Well, I think there's two sides to it because yes, a lot of people do want to have experience, but for myself over the years when I've been in different roles from a management or a lead perspective or, having to train new staff coming in and things like that, I have to say, not everybody that comes in with experience has even some of the basic skills that we would need to develop to further their career, for example. So, I know a lot of organizations look for that, but at the same time, I think there's a lot of value in someone who doesn't have experience. You just have to be there to mentor them properly. With people who are looking for different jobs, I think one of the other issues is that you have the online based companies, so the remote work where they can't be as hands-on sometimes with staff, and that's a challenge. But then you also have people that are in the local community or maybe local hospital facilities, things like that, and then it becomes problematic because they don't always value the position and they want to underpay people.
Yeah,
So it's really, really hard to navigate the field. But, one thing in my experience, I've said this before, I've been on a couple podcasts recently that'll come out in the future where I talked about my own personal beginning. And one of the things that, has gotten me to the point where I am is just taking every opportunity that presents itself, regardless of what it is. So, what I mean by that is, if you are having a challenge getting into the industry, look for something that's associated with what you're wanting to start in. For me, I started in a customer service position that was helping patients figure out their claims or figure out their payment plans. So I learned a ton because I was looking at all these denials.
Yeah.
So, trying to get in, still pursue, don't settle. Don't settle for things just because you have this dream and this want and what you're working towards. But it's definitely very challenging, but I like your point about showing the value that you do have. And there's things that you just can't teach people as well. There's so many times I've worked in positions, and I hate this part of management where I've had to be a part of people being let go from an organization because they were dishonest, stealing time at work or not showing up or not, doing their best, doing the least possible. So, to me, in that management perspective, those are types of things you can't teach people. You can't teach someone to be ethical and to be a good, honest person. They
Yeah.
have to want that for themselves. So, those types of skills for me are something that I put more value on when I'm looking to work with people than necessarily only looking for people with a certain number of years of experience.
Yeah, and that's something that we are doing here in Coding for Health is providing EHR training because
Mhm.
we all know,
Oh, yeah, that's
yeah,
great.
EHR is something that we are gonna work on it when we get our first job.
Mhm.
Every clinic use EHR, a lot of them like Epic, Practice Assist, um, Next Gen, a lot of them, and we are using EHR Go, who is a platform who teach our students how to navigate and how to manage the NEALs, how to code different case, the NEAL management. There is a lot of homeworks
Mhm.
on their EHR Go, and we are using it, and our students are learning so they can add value to their resume. And
Mhm.
in the interview, they can provide that value and saying, oh, I have experience working on EHR training, I know how EHR look like.
Mhm.
So because when we graduate as a coder, we have no idea how it EHR look like.
Mhm. Yeah.
So we are doing that like 6 months ago. We start doing it,
Okay.
and it's going well so far. they,
Yeah.
they, they are learning too much about EHR, and I think
Yeah.
it's important. What do you think? I think it's really important. Learn
Yeah.
EHR and how to
Yeah,
navigate.
and yes, yes, and definitely that's the type of thing that should be highlighted on a resume,
Hmm.
because that's hands-on experience. And there's times that, for example, people will go through programs where they have you code cases, but you still don't get those other components. So
Exactly.
it's great to have any kind of exposure into something like that. And another thing too I just thought of, and it depends as well at what point in someone's career they're in. So, a lot of your students, yes, are starting in the beginning, but as they're looking forward, you want to have your future goals too, is right as well. So, looking into the future, even things like experience in Excel, experience writing, different types of reports and things like that. That helps a lot as well, just because of the nature of the work if you're progressing into like an education position or things like that. But I can see a lot of value in what you're doing, what your students are being prepared in. And there's a lot of English based programs that are not going into that depth. So I
No.
think that that's really great that you're giving them a lot of tools through the program.
Yeah, yeah. I always are thinking and growing and provide the best education, and I found that the most challenging thing is getting that job
Hmm.
because they are getting certified, but most of them are need to wait like months to get that first job. And I understand get that first job is complicated in too many things because we need to build a great profile on LinkedIn. We need to send at least 10 applications every day, at least.
Hmm.
And not everybody do that. So I think to get that first job, it requires a lot of responsibility and
Mhm.
consistency also.
Yeah. Yeah, and for me, when I jumped into the remote world from working in a hospital setting, I would say that that was pretty hard for me back then because just working with all the different recruiters. But now, I hear all of these different stories about people that don't even get looked at because AI is just
Mhm.
scanning resumes and moving along or things like that. And, I think one thing that it can be very beneficial to people that are looking is to get in to LinkedIn, like you're saying, put everything into that profile, but start networking on there too.
Mhm.
There, if you can get in with different recruiters, they have lists of specific things that they're looking for and people that they need to identify for a client.
Yep.
And that can be really helpful to have their guidance as well to kind of get through things like an AI program scanning to see if it wants to move forward with an interview, which I wouldn't even know what to tell you to look for to bypass
Yeah.
an AI review.
Yeah, yeah, of course, yes. Well, and talking about AI, what do you think how our future, our coding future is gonna look like with
Yes.
AI revolution?
So I feel very strongly that this is just going to be here as a tool. And what I mean by that is, maybe it's going to be something where it's going in and identifying different parts of records that, maybe it would take us hours to read through, but that can identify a lot of keywords and start to highlight things for someone to go through and essentially review or abstract faster.
Yep.
um, I have had a lot of experience with different AI companies really over the past year where, I'm doing a lot of consulting, whether it's helping them develop their software and compare it to things within compliance and medical coding. And then, there's also people who are building these efficiency type tools out there. But, I'm still curious to see what will happen in the coding side of this industry because I don't see this being set up in a way where, we could go to hospitals and hospitals are going to individually purchase these type of products.
Mhm.
There's a lot of cost that comes with that. And, there's a lot of budget issues that typically exist in those settings. So I'm seeing it more integrated into like the EHR and the provider side. It may be looking to select a code, but not really fully being able to 100% give that objective view.
Exactly.
And that's what I've found even with those that are developing products. There's so much subjectivity in what we do, and that unknown component makes it really hard to tell a system, if this, then do that.
Yeah, exactly. Yeah, I'm agree. I'm totally
Mhm.
agree. And also, I was reading, I think it was last week, that the BSL say that the medical coding field industry is gonna grow like in 9.2% for the next 10 years. I don't know. How do you think about what do you think about that? But I'm totally agree
Mhm. Yeah.
about the growing of the industry independently about the AI thing.
Yes. So a couple of things. Yeah, I definitely think there's going to be growth, but there also has to be this shift for practices and even some facilities to recognize why it's necessary. With what I do in consulting and auditing on the preventative side of the industry, a lot of people will be like, well, what does that cost? I don't know that I have the ability to pay that right now. But then when I do all of my legal defense work, it costs even more. And then they
Mhm.
have to get an attorney on top of it. And there's a lot of cost there. So people really need to notice and pay attention to the fact that they have to invest in compliance. It's a part of doing business in the healthcare industry. It's not like other highly regulated fields where things are more black and white. I think there's always subjectivity within the regulations, but there's a lot of nuances and not just in the coding rules and the policies we follow, but look at the differences payer to payer.
Yeah.
It's a mess trying to navigate that. And when I try to teach physicians certain parts of it, it's just like, they're just dumbfounded by the amount of information a person needs to know to do it correctly. And that's how some people get themselves in trouble on the legal side or with owing a lot of money back and things like that, because it is a lot to navigate. And you need to go to someone that has that experience to make sure that you're covering yourself. And I personally think a large part of that is having coders involved. um, you know Providers and facilities struggle when they don't look at that and do that as an investment.
Hmm.
And it's one of those things that they have to mitigate where they want to spend and where they want to be worrying the most, essentially.
Yeah, yeah, totally. I'm totally agree with what you're saying. Yeah,
Mhm.
I think medical coding is gonna grow definitely for the next 10 years. I'm totally agree. With this thing about I think like you say before, it's going to be a tool for now. That's
Mhm.
what we are seeing. But the critical human thinking is needed all the time.
Yes,
We need
exactly.
it because we are managing a lot of information. We have HIPAA, we have law that we have to accomplish. We have to take care of it, and I think it's going to be a tool for the next years, in my opinion.
Mhm. Well, and I've seen with some organizations, they're making very drastic decisions
Hmm.
where they are, letting go, completely firing their entire coding department, say 50 to
Complete.
70 coders and sending it offshore. And, we've seen patterns in the billing side of the industry for many years where people try to, pay the least possible, but yet they're surprised when the revenue has a massive issue. And,
Hmm.
I'm even currently working with some clients where, I'll say, okay, well, what's the rate you pay for your billing services? Okay, if that's a dirt cheap rate that you're paying for your billing services, that's exactly why, that even will tell me in my own review that there's offshore work. And that's exactly why there's a disconnect, because they don't have the same training that we have. And that's one thing I really, really like about what you're doing. AAPC and some organizations have opened things internationally, and there's constantly quality issues with the work that's done that way. I don't feel like they're getting the proper support, the proper education. It's kind of just teaching to pass something at that
Hmm.
point, and you're really investing in your organization and your students to give them more and more substance, really, and not just a surface level to pass a test.
Exactly.
So I think we're going to see this cycle start happening with coding. And it's going to take a little bit of time, because with something like coding, it's going to probably take them going through an audit and seeing how bad the results are. I think that people would have a better chance of honestly coding through software and using AI than they would offshore, just based on the way that those models are set and the way that it's done in the industry. Now, I say that, but I do know of a couple people that are working closely and hands on, and they know those typical issues that exist, and they're working to improve that. But again, these different organizations that are seeking that route are not valuing it or mitigating their risk, because they're wanting to pay bottom dollar. And
Correct.
anytime
Yeah.
you're looking for the cheapest option possible, that's what you're going to get out of it, and it's not going to be good. So
Exactly.
I think we're going to have that cycle back, but it's hard to see right now what people are going through in the industry, where, these companies are just listening to a salesperson, and they're going to have to, unfortunately go through some hard times that they're going to have to recover from to see that that wasn't a good decision.
Yeah. Yeah, that's right. That's totally right. Yeah. Stephanie, I think I have a question here
Sure.
about the what do you think? Because when we graduate as a coder, we think at the beginning that the only thing that we can do is work from home or work for another company. But there are a lot of business opportunity for those who want to become a coder. And
Mhm.
I think maybe we cannot go into the business right when we get certified. I think we need to
Mhm.
learn a lot, at least work 1 year at least for a company.
Yeah.
But we have a great opportunity in the business field in this industry. What advice do you recommend to the Hispanic community student about those type
Mhm.
of things?
So a couple of things for the Hispanic community and also for anyone looking to get in this industry, I highly suggest looking for a role in person first. There's a lot of people who will go through programs and, they will say, for example, I had someone here in the Knoxville area reach out to me, and the person spent all of this time and money in school, and they said, I'm having a hard time getting a job. And I was like, okay, we have some really great large hospital systems in this area. Are you looking at those for an opportunity there? And they said, no, I can only work from home and I don't have the ability to go in person. We have one car, all of these things. And they're like, that's why I went to school for this, because I can't work in person. That, I think, is not doing yourself a favor. If this is something that you're looking at as a career that you want to invest yourself in, I think that you need to spend time in person. There's so much that I saw and experienced, and it's one of those things too. A lot of times when you're working in person anywhere, but typically there's a lot of work that has to be done and not enough time and people, right? So
Yep.
a lot of times what will happen is you get exposed to more things just based on that. You're going to have an opportunity to maybe help another department, or maybe you got caught up on your work, so you're going to go help someone that's working a different specialty in your department, things like that. From the perspective for the Hispanic community, I would think that it would be a good opportunity in person to help some with the language piece. So if you are struggling with anything with a language barrier, that can really help to have more hands-on, to be there, to have coworkers right there with you to help. If there's something you see that you don't understand, which everybody goes through, maybe look over at your coworker and say, hey, could you just help me to understand this? Or, your lead or whoever is there. So, I think that you can get more dedicated time from those within your department and your leads when you're in a role in person as opposed to being remote.
Yeah. Yeah. I'm agree. I think we need to learn a lot at the beginning that we need it.
Mhm.
And if you want to grow in this industry, we need to go first some role in person. Yeah.
Mhm.
I'm totally agree. Yeah.
Yeah. Yeah. Even if it's working, in a practice, sometimes in smaller
Yeah.
practices, they don't have as much staff. So you do a couple of different roles. Maybe it's front desk, but you're also doing some coding and billing and denial work, things like that.
Mhm.
All of that is great exposure. It's just, more tools that you add in that you can put towards your knowledge as you go forward. I think
Exactly.
it's huge.
Yeah. Exactly. Yeah.
Yes. Now, to end for today, let's just talk a little bit about what it is that you're hoping to accomplish, even in the next couple of years here with coding for health. Do you
Mhm.
have other things, like you were saying, you're adding in, the EHR component? That's great. Do you have any goals or things like that that you're looking at for your organization?
Yeah. One of the goals that I'm thinking is try to provide some internship
Mhm.
to our students in order to gain more experience in the field, because I know that getting a job is the most challenging thing for our student.
Mhm.
But I also understand that our job is provide a great education. because that's our main goal, and that's our goal of the university of college, provide education, not jobs.
Hmm.
But I think if we can provide a tool like ESR training, like some internship, in order to gain that experience that the employers want, is going to be great. One of the goals is going to be internship experience, and another big goal is try to provide the same like the platform, the course to a college or a
Hmm.
huge university
Yeah.
who are teaching medical coding in Spanish, but sometimes they are no like preparing for the CPC certification, because I
Hmm.
found that I have a lot of students who come from me after get training with another college and go to me, hey, I tried to pass the CPC certification, the CPC exam 3 times, and I didn't pass it. And
Hmm.
I studied in that college, in that university, but I think I'm not fully prepared for that exam. So I think try to, like get a great conversation with a college or university and try to provide the course for their students so they can get prepared for the CP certification, for example. I think
Hmm.
that's one of the other goals that we have in Coding for Health.
Yeah.
Definitely.
That's great. That's awesome. We actually had someone put a comment on here. They're a part-time coding instructor, and they do currently have Hispanic students that are struggling to understand medical terminology. So I could definitely see that too, because that's a hurdle sometimes, depending on programs people go to, even English speaking programs,
Mhm.
if you don't have a good base in something like medical terminology, that alone could make it more difficult. So, I think that that's great, and for sure
Yeah,
that
that's
would be.
great. And something that we do in Coding for Health is teaching medical terminology and anatomy at the same time that we are seeing the content. For
Mhm.
example, if we are in the 10,000 series in the tegumentary system and musculoskeletal system, for example, we are teaching how to code the guidelines and also the medical terminology and anatomy for that section. And the reason why we do that, I think medical terminology and anatomy, in my case, I study medicine. It's going to be more easy for me,
Mhm.
but most people don't. And try to teach something first, like medical terminology and anatomy, which is huge. It's
Mhm.
very, very huge. Um, First, and then start study medical coding. Yeah, it's gonna work. But if you study at the same time the same system that you are saying that you are trying to code, the same system you are studying the medical terminology, I think it's gonna be better. If you are studying, for example, digestive system, how to code the guidelines, CPT guidelines, for example, because in ICD-10 we don't have it, but in CPT we have guidelines for how to code the digestive system, and at the same time we are learning the anatomy and the medical terminology. That's the way that we're doing going for health, and I think in that way they are learning a lot. They are learning more that if they start studying medical terminology first and then medical coding, like
Mhm.
I don't know if you understand what I'm trying to, like, I
Yeah.
think it's better putting together and
Yes.
studying at the same time that you are studying a system.
I think that makes sense because I do know what you're saying, where a lot of programs teach it first.
Exactly.
So, yeah, they're going in cold. They don't really know anything about the body systems and all of that. And they're starting with med term. For me, when I did different college courses, we did med term, then we did anatomy afterwards. And then we went into, some other things and disease processes. But yeah, it's all separated out. It's not typically combined together.
Exactly. Yeah.
Yeah,
We're
that's
doing it
great.
that way, and I think it's working, and I think it's gonna be better. That's the way that
Mhm.
I did when I started medical coding, and like I say, medical terminology for us who start medicine in our country is not difficult, just the language. But the medical terminology in English and Spanish is writing like the same way. The
Mhm.
hypertension, diabetes in Spanish, you can write it like the same way. So it's not too hard, like learning when you already start medicine, for example, or nursing in your country. When you come from zero, I think the best way is starting together at the same time that you are studying how to code a body system.
Mhm. Yeah,
Mhm.
that's great. Now, before we go, can you let everyone know where they can find you?
Yeah, yeah, they can find codingforhealth.com, and from there, that's our web, and they can see our program. They can see another podcast who is in Spanish with Claudia Valdez, who is an influencer from Cuba, and they can see a podcast who is live in YouTube. It was recorded like a month ago, and there are a lot of information about the field, about our program, about medical coding in general, and also in Instagram, like codingforhealth.com, we can find out, and on TikTok. We are
Okay.
on TikTok, Instagram, and our web. On LinkedIn, we don't have too many posts on LinkedIn. Honestly, we have to build it. But yeah,
Mhm.
LinkedIn, we're gonna start posting more.
Yeah, that's great. All right, and I'll make sure that there's links to everything in the notes for this episode as well, so you can find the website and the social media platforms. But I thank you for joining. I think this was, a really good topic, and I think a lot of even English-based programs could take away quite a bit from what it is that you're building. I think you have a lot of value with what you're doing, a lot of intention, and I think that is a great way to build people from the beginning and as far as their skills and going out into this industry.
Yeah, thank you, Stephanie. Thank you for having me. It's going to be a pleasure. Thank you. Thank you so much. Honestly, thank
Yes.
you.
Yes. All right. Thanks everyone for joining, and we'll catch you back next week.